Bismillahirrahmanirrahim. Assalamu alaikum students. Today's topic is prenatal diagnosis. The perinatologist has several approaches for assessing growth and development of the fetus in utero. That we want to see the status of the fetus in, in utero. The approaches are which include ultrasound, amniocentesis, chorionic villus sampling, maternal serum screening. Mostly we do the non-invasive technique. If we see that this is the high risk patient, then we will do the invasive techniques. So in routine we use ultrasound technique for looking for the growth and development of the fetus. When in combination, these techniques are designed to detect malformations, genetic abnormalities, overall fetal growth, complications of pregnancy such as placental or uterine abnormalities are the we can see all this by this technology. Other techniques include alpha fetoprotein assay, 6 chromatin pattern, cell culture and chromosomal analysis, fetoscopy, percutaneous umbilical cord, blood sampling, CT scan and MRI, spectrophotometric studies. So these all techniques we use to detect the malformation, genetic abnormalities, fetal growth, and to see the complication of pregnancy such as placental or uterine abnormalities. Now we will discuss these one by one. In case of the ultrasonography, how will it work? Ultrasonography is relatively non-invasive technique that causes high frequency sound waves. Sound waves reflected from tissues to create images. So ultrasound works that it will use high frequency sound waves which are reflected from the tissues to create images. And we will see the image and then we'll diagnose the status. The approach may be ultrasonography, approach may be transabdominal. Number 2 is the transvaginal. With this approach, we will produce image with higher resolution. So in this slide, we know how ultrasonography works. That it uses high frequency sound waves. Sound waves are produced which will reflect from the tissues to create images. Approaches are transabdominal and transvaginal. In fact, this technique, which was first developed in the 1950s, has advanced to a degree where detection of blood flowing through major vessels, movement of heart valves, flow of fluid in the trachea and bronchi is possible. This technique is safe and commonly used, with approximately 80% of pregnant women in the United States receiving at least one scan. Which important parameters we can reveal by ultrasound? These include characteristics of fetal age and growth. We can see what is the fetal age and how it is growing. Number two, presence or absence of congenital anomalies. By ultrasound, we can assess the congenital anomalies. Number three, status of the uterine environment, including the amount of fluid. Number four, placental position and umbilical blood flow. Number five, whether multiple gestations are present, so that the fetus is one or two or three. All of these factors are then used to determine proper approaches for management of the pregnancy. So we can manage the pregnancy by looking these factors. Determination of the fetal age and growth is crucial in planning pregnancy management. If the growth and fetal age they are in relation with each other, then we can plan pregnancy management. These studies show that ultrasound screened and managed pregnancy with low birth weight babies reduce the mortality rate by 60% compared with an unscreened group. That if we have screened that by ultrasound, we came to know that these are the low birth babies, then we can manage these babies. If we don't know that a woman is having the low birth weight baby, so low birth weight babies, if we know, we can manage them. If we don't know, then we will not be able to manage properly. Fetal age and growth are assessed by Cron-Rump length. How can we assess that Cron-Rump length? Cron-Rump length is the length from the skull vertex to the buttocks during the sitting position of the fetus. So, by the Cron-Rump length during the 5th to 10th weeks of gestation, we used to see the fetal age and growth by Cron-Rump length during the 5th to 10th weeks of gestation. After that, a combination of measurements including the biparietal diameter, parietal are the two parts of the skull, biparietal diameter from one parietal eminence to the other parietal eminence, we take the diameter and from this we can judge the age of the fetus. So biparietal diameter of the skull, femur length and abdominal circumference are used to assess the fetal age and growth after the 10th weeks of gestation. Before 10 week, we use Cron-Rump length. Between 5th to 10th week, we use Cron-Rump length to assess the fetal age and growth. And after 10th week, we will use the measurements of biparietal diameter, femur length, and abdominal circumference for fetal age and growth. Multiple measures of these parameters over time improve the ability to determine the extent of fetal growth. So, if the fetus is normal and growing well, then nothing will happen, and we will use the standard methods to plan and the management. But if we have the congenital malformations that can be determined by ultrasound include neural tube defects, anencephaly, and spina bifida, then the management of pregnancy will be changed. Abdominal wall defects such as amphilocele and gastroschisis, etc. Heart problems like atrial septal defect, transposition of great vessels. There may be the facial defects, including cleft lip and palate, etc. If the fetus have malformations, then plan management of pregnancy will be changed accordingly. Now coming to the advantages of ultrasonography include estimation of gestational age. Number two, evaluation of embryonic growth. These are in relation with each other, that gestational age and embryonic growth we can judge by ultrasound. Number three, guidance during amniocentesis and chorionic villi sampling. With the help of the ultrasound, we can do these methods. Number four, suspected ectopic pregnancy. We can see by the ultrasound. Number five, possible uterine abnormalities if present. We can see them by ultrasound. Number six, detection of congenital abnormalities. So we can detect congenital abnormalities with the help of the ultrasound. So ultrasound, which is using sound waves, high frequency of sound waves, and by this reflect, there will be the image reflection by the tissues to produce the image. And with the help of this, we can estimate, we can have estimation of gestational age, evaluation of embryonic growth. Ultrasound will be help in guiding during amniocentesis and chorionic villi sampling. Suspected case of ectopic pregnancy we can see by ultrasound. Possible uterine abnormalities, if there are, then we can see under by ultrasound. Detection of congenital abnormalities. So this is about the ultrasonography. Then come to the second step, that is the maternal serum screening. If we suspect anything or there will be the history, then a search for biochemical markers of fetal status led to development of maternal screening tests. One of the first of these tests assessed is the serum alpha fetoprotein concentration. Alpha protein. Why we are checking the alpha protein? Alpha protein is produced normally by the fetal liver and peaks at approximately 14 weeks. Alpha fetoprotein, these are produced by the fetal liver and its peak level at 14 weeks of gestation, and then it will come into the maternal circulation via the placenta. When it will reaches to its peak level, then it will come into the maternal circulation, and the time is 14 weeks of gestation. The alpha fetoprotein concentration increased in maternal serum during the second trimester and then began a steady decline after 30 weeks of gestation. So after 30 weeks and before 14 weeks, we can't do alpha fetoproteins serum concentration. We will have to check the alpha fetoprotein serum concentration in mother between 14 weeks to 30 weeks. So this is the time when we will check the serum alpha proteins of the mother. What will be the help to check the alpha fetoprotein? So if we have alpha fetoprotein levels, if they increase, then a fetus may have neural tube defects, omphalocele, gastroschisis, bladder exostrophy, amniotic band syndrome, sacrococcygeal teratoma, and intestinal atresia. Okay, if the alpha fetoproteins which we have checked in serum of mother, if there is the increased level, then these defects can be in the fetus. Second case is that serum alpha phytoprotein concentration may decrease. If there is the decrease in the alpha phytoprotein concentration, then we can have the fetus with Down syndrome, trisomy 18, sex chromosome abnormalities, uh, or triploidy. These conditions are also associated with lower serum concentrations of human chorionic gonadotropin and unconjugated estriol. Therefore, maternal serum screening provides a relatively non-invasive technique for an initial assessment of fetal well-being. So, this is about the non-invasive techniques of prenatal diagnosis. Then, after this, I will tell you about the invasive techniques of the prenatal diagnosis. This is all about the non-invasive technique. All the students of first year will make the assignment of this lecture and will send me by me. Thank you. Allah Hafiz.